On September 4, 2025, the Senate Finance Committee hearing room buzzed with tension. At the center sat Robert F. Kennedy Jr., the newly appointed Health and Human Services Secretary, facing his first major public grilling. Senators from both parties pressed him on his controversial vaccine views, a topic that has defined his public life. Senator Warnock called Kennedy's appointment a hazard to public health, while Senator Cassidy, a physician, shared a story of a cancer patient denied a COVID-19 vaccine, blaming the uncertainty Kennedy's leadership had sown. Kennedy defended his actions, claiming he aimed to restore trust in compromised public health institutions. When asked about the COVID-19 death toll, Kennedy questioned the official figures, shocking the room. He insisted he was not anti-vaccine but pro-science, and justified firing the CDC's Immunization Advisory Board as a move to eliminate conflicts of interest. The hearing became a microcosm of America's deep divide over science, trust, and public health. For supporters, Kennedy was a truth-teller. For critics, a dangerous charlatan. The stakes were clear. This was about more than one man. It was about the future of public health and who Americans choose to trust. The nation watched, knowing the outcome would shape the country's health for years to come. Robert F. Kennedy Jr.'s path to vaccine skepticism began long before his fictional HHS appointment. Once a celebrated environmental lawyer, Kennedy gradually became the nation's most prominent vaccine critic. Through Children's Health Defense, he argued that rising rates of chronic illness in children were linked to vaccines, despite scientific consensus to the contrary. He alleged that public health agencies like the CDC were compromised by ties to pharmaceutical companies, fueling distrust. Kennedy's message resonated with parents who felt ignored by the medical establishment, building a devoted following. The COVID-19 pandemic amplified his warnings about government overreach and lack of transparency. His 2024 independent presidential campaign united voters skeptical of both government and big corporations, making vaccine skepticism a potent political force. Kennedy's journey transformed him from environmental crusader to the face of a national debate over science and trust. Kennedy's rise has deepened America's polarization over vaccines. His supporters, often parents who believe their children were harmed by vaccines, see him as a courageous advocate for personal liberty and medical transparency. They distrust pharmaceutical companies and believe vaccine risks are downplayed by a complicit medical establishment. Online, their stories and doubts are amplified, fueling a movement that questions mainstream science. The majority of Americans, however, trust vaccines and see them as essential to public health, crediting them with eradicating deadly diseases. For this group, Kennedy's rhetoric is dangerous misinformation that threatens herd immunity and public safety. The debate is not just scientific, it's a battle over trust, expertise, and the future of public health. The divide is stark, with each side convinced the other endangers the nation. Polls reveal a nation split on vaccines. A 2023 Pew survey found 70% of Americans believe childhood vaccines' benefits outweigh the risks, but 28% are skeptical or believe risks are equal or greater. This minority represents millions, enough to impact herd immunity and public health. The COVID-19 pandemic hardened attitudes, with skepticism higher among Republicans and independents. Kennedy's 2024 campaign showed vaccine hesitancy is not fringe. It's a significant political force. Public health leaders now face the challenge of combating both disease and the viral spread of doubt. The numbers show trust in vaccines remains strong, but skepticism is a growing headwind. The gap between Kennedy's claims and scientific consensus is vast. Major medical organizations and decades of research have found no link between vaccines and autism or chronic illness. Health experts warn that Kennedy's platform spreads dangerous misinformation, making it harder to protect the public. Doctors now spend more time countering fears fueled by online theories and high-profile skeptics. Kennedy's focus on alleged conflicts of interest at the CDC is used to dismiss overwhelming evidence of vaccine safety. The scientific community stresses that vaccine approval is rigorous and transparent. Kennedy's appointment as HHS Secretary has alarmed medical organizations who fear a public health crisis. For experts, this is not a debate between equals, it's fact versus falsehood. The stakes are real, as declining trust leads to outbreaks of preventable diseases. The debate over Kennedy and vaccines has real consequences for public health. Eroding trust in vaccines threatens herd immunity, putting vulnerable populations at risk. Under Kennedy's leadership, states like Florida are moving to end school vaccine requirements, unraveling decades of disease prevention. Confusion and politicization create a patchwork of regulations, leaving children's safety dependent on geography. Medical professionals face harassment for promoting vaccines, making it harder for families to get reliable information. The public health system is strained, battling both disease and a flood of misinformation. Ultimately, the nation's health depends on whether Americans choose to trust science and unite for the common good. The choices made now, about vaccination, trust, and leadership, will shape the country's future. The vaccine debate is a test of America's ability to protect itself through science and reason. Its outcome will determine the health of generations to come.